Actinic keratosis. What is actinic keratosis? It's also known as solar keratosis. They're precancerous lesions. Photodamage accumulated over time can result in actinic keratosis. If not treated, actinic keratosis may develop into squamous cell carcinoma. Dysplastic or abnormal cell growth. It enlarges slowly and takes years to develop. It's not usually accompanied by other signs or symptoms aside from a small spot, bump, or patch present in the skin. Who is most at risk? Most commonly appears after the age of 40, with a Fitzpatrick 1, 2, or 3 are more likely to develop actinic keratosis. A history of intense sunburn, frequent or chronic sun exposure. Those taking immunosuppressants or with a compromised immune system, or individuals with a history of actinic keratosis or skin cancer. Recognizing actinic keratosis. It can be red, pink, brown, or flesh-colored. They're rough patches of skin, flat or slightly raised patch or bump on the epidermis. They're usually less than 1 inch in diameter and can occur in small groups or patches. They can resemble a wart or be crusty and scaly. It may feel rough to the touch or like small needles or splinters poking out of the skin. Itching or burning sensations may occur in the affected area. They're found primarily on areas that are exposed to the sun, such as the face, temples, forehead, hairline, ears, hands, lips, back of hands, forearms, scalp, and neck. Typically, actinic keratosis is easily diagnosed by a dermatologist with a simple skin examination, but may require a skin biopsy. Because actinic keratosis are considered a precancer, removal is advised as a precautionary measure. Early treatment increases the likelihood that it will not develop into cancer. If left untreated, progression of squamous cell carcinoma may develop. Surgical treatments include cryotherapy or freezing. It's a surgical procedure performed by a dermatologist that involves applying liquid nitrogen to the affected area. Blistering and peeling occur, and lesions will slough off during the healing process, resulting in fresh new skin. Curettage or scraping is a surgical procedure using a device called a curette, which scrapes off the affected cells. Electrosurgery is an electrical current used to cut and destroy the damaged tissue using a pencil-shaped instrument. It does require a local anesthetic, and it may be performed in addition to curettage. The side effects may include scarring, textural skin changes, infection, and hyperpigmentation at the treatment site. Other treatment options include photodynamic therapy, which is where a photosensitive chemical solution is applied to the affected area for 30 to 40 minutes prior to irradiation with visible light. The light exposure initiates a tissue-toxic photochemical reaction which destroys the actinic keratosis. Side effects may include redness, swelling, and burning sensation during treatment. Chemical therapy are topical treatments prescribed for home use. It's equivalent to a medium-depth chemical peel as it exfoliates in an effort to remove the photodamaged skin. It may cause erythema, redness, scaling, or burning for several weeks. Skin may appear raw. It's usually prescribed for treatment on a large affected area where several lesions are present. Sometimes it disappears on its own. It most likely will return after more sun exposure. Protecting yourself against actinic keratosis. Excessive sun exposure can result in many damaging effects to the skin, such as hyperpigmentation, aging, skin disorders such as actinic keratosis, and cancer. Taking proper measures to protect yourself from UV rays is the best way to prevent skin damage. Minimize your time spent in the sun. UV rays are most damaging between 10 a.m. and 2 p.m., so try to avoid these times. Avoid sunburn or tan. Use sunscreen with an SPF 30 on a daily basis. Wear protective clothing and a sun hat. No tanning beds. Try a spray tan instead. Do self-skin checks and visit your dermatologist yearly.